Welcome to the COVID-19 information training for CSUSM interns and experiential learning students. The SARS-CoV-2 virus and the disease it causes, COVID-19, have significantly impacted the way society in general, and higher education specifically, conduct day-to-day operations. This training will review general information regarding COVID-19, reinforce established prevention strategies, and offer guidance on how to respond if you are exposed to or experience symptoms of COVID-19. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person between people who are in close contact with one another, within about 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land on the mouths or noses of people who are nearby or possibly be inhaled into the lungs. This virus may also spread by touching contaminated surfaces and then touching your mouth, nose, or eyes. It is very important to clean your hands often. Wash your hands often with soap and water for at least 20 seconds, especially before you eat, after you've been in a public place, or blowing your nose, coughing, sneezing, or using the restroom. If soap and water are not available, use a hand sanitizer that contains at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. Remember, hand sanitizer does not remove dirt or other materials from your hands. Washing your hands correctly makes all the difference in preventing the spread of diseases. Wet your hands with clean running water, preferably warm water, and apply soap. Rub your hands together to lather up the soap. Be sure to get all surfaces of your hands, including the back of your hands, between your fingers, in any wrinkles, under your nails, and under any rings. Scrub your hands briskly for at least 20 seconds. Rinse your hands under running water and dry them thoroughly. Your placement site should provide you the location of the hand washing sink nearest your workspace. Because COVID-19 is spread by infectious droplets, it is important to cover your mouth and nose with a tissue when you cough or sneeze. If one is not available, use the inside of your elbow. Throw used tissue in the trash and immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. When used in conjunction with other preventative strategies, face coverings can reduce the spread of COVID-19. Face coverings are Community Protective Equipment, CPE. They are intended to protect other people from infection by reducing the release of potentially infectious droplets. They are not personal protective equipment, PPE, as they are not designed to protect the wearer from environmental hazards. As stated, face coverings supplement other practices. They are not a replacement for physical distancing, proper hand washing, or staying at home if you are sick. Make sure that you wash your face coverings frequently using the highest temperature recommended for its fabric. The state of California and the county of San Diego have released requirements regarding the use of face coverings. You must have a face covering on your person when you leave your home. You are expected to wear your face covering when in any indoor public space, when waiting in line, when getting health care, when using public transportation or ride sharing, at work, when near others or moving through common areas, and outdoors if you can't stay 6 feet away from others. Your placement site may have stricter protocols, and they should provide you with specific guidance on when and where to use a face covering. In addition to practicing good hand hygiene and wearing face coverings, maintaining physical distance from people outside your household group is a key strategy to prevent the spread of COVID-19. The CDC recommends staying at least 6 feet away from others. Look for distancing markers and/or signs in the public spaces to provide a visual clue. An easy way to approximate 6 feet is to visualize 2 outstretched arms. 6 feet is about the length of 2 outstretched arms. If you have had close contact with a person who has COVID-19, you may need to quarantine at home. The CDC and County Health Agency define close contact as being within 6 feet of a COVID-19 patient for more than 15 minutes. Alternatively, if you have had unprotected direct contact with body fluids from a COVID-19 patient, this also is considered to be close contact. When you quarantine, you stay at home except to receive medical care. You must quarantine for at least 14 days. Make sure you communicate with your placement site and CSUSM contact if you need to quarantine. In order to protect yourself and those you interact with at your placement site, make sure you monitor yourself for symptoms. Evaluate yourself daily for COVID-like symptoms and take your temperature before leaving the house if feasible. If you experience a fever of 100 degrees Fahrenheit or more, or have other signs and symptoms of COVID-19, stay home and do not report to your placement site. Notify your placement site and CSUSM contact, and call your healthcare provider for guidance. Examples of COVID-19 symptoms include cough, shortness of breath, trouble breathing, fatigue, body aches, headache, sore throat, new loss of taste or smell, congestion or runny nose, nausea or vomiting, or diarrhea. Of course, if any of your symptoms are life-threatening, call 911 for assistance. Expect your placement site to conduct symptom screening. Your placement site should conduct COVID-19 screening, which may include symptom, contact exposure, and/or travel questions, and possibly temperature check. As stated previously, if you have experienced symptoms, do not report to your placement site. Stay home and contact your site and CSUSM contacts. Consult with your healthcare provider and seek assistance if your symptoms worsen. Always call ahead before visiting your healthcare provider. If you have COVID-19 signs and symptoms, have tested positive for COVID-19, or have been advised by a healthcare provider that you most likely have COVID-19, you must isolate at home per the County of San Diego Health Order. This means staying home except to receive medical care and separating yourself from household members. Specific criteria must be met before you can stop isolating, including becoming fever-free and experiencing noted improvement in symptoms. Expect isolation to last at least 10 days. Immunocompromised individuals may have to isolate for at least 20 days. To counteract the spread of COVID-19 from contaminated surfaces, follow your placement site's sanitation procedures. Cleaning and disinfecting frequently touched surfaces daily when combined with good hand hygiene reduces the potential exposure from objects. High-touch surfaces include tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. Your placement site should instruct you on their specific sanitation procedures. Minimizing the use of common or shared supplies and equipment reduces the potential for exposure as well. You should not share office supplies like staplers, pens, and telephones. Avoid shared workstations if feasible. Use hand sanitizer and/or disinfect common equipment like photocopiers if possible. Again, your placement site should provide guidance on their specific work practices.
You have now completed the CSUSM COVID-19 training for interns and service learning students. If you have additional questions regarding COVID-19, you can find general campus information at www.csusm.edu/CSUSM-as1. Additional support is also available. Internship students should contact the Career Center at 760-750-7005 or internships@csusm.edu. Service learning students should also contact the service learning staff at 760-750-4055 or servicelearning@csusm.edu. Placement site specific questions should be directed to your on-site representative.